We're all learning as we go. We now know that probably the best mitigation factor we have is mask wearing. I don't think that was clear when this first started. We now know that this virus doesn't only travel in large droplets. We know it travels in small droplets as well. And so while 6-foot spacing is great, it's not as good as mask wearing.
Please follow the golden rule. Be respectful of others. Wear a face covering when you're indoors and in public. It's the number one return on investment tool that we will have until the vaccine gets here.
So if the vaccine comes out and somebody gets harmed, the deterministic human will go, the vaccine is bad. You have to be very careful, given the level of public scrutiny, the level of sort of dependency on this vaccine to solve our problems. You've got to take double, triple, quadruple checks. Otherwise, we just never get this opportunity back. An entire generation of people will never trust vaccines again.
I'm totally convinced that this virus is very responsive to good and bad policy decisions. Did our elected officials and the people that advise them learn lessons? We'll see.
Hey everybody, welcome back to the Vitalist Spark podcast. I'm your host, John Ford. Believe it or not, it has been 6 months since our first COVID-19 roundtable. After a half year of rapid response to what's been going on in the previous 2 weeks, this episode takes time to take stock of the entire past 6 to 8 months and what we've learned. From there, we spend time looking forward, based on what we're learning, to formulate a sense of what life might look like in the coming months. Of course, we can't help but conclude this episode with a look at vaccines, and a poor attempt at Vegas odds on when we'll be seeing those vaccines reaching Arizonans. As our guests alluded to in the opening sequence, masks are where it's at. Follow the golden rule and be COVID smart. Stay at home as much as you possibly can, wash up, mask up, maintain physical distancing, and keep a heads up for your fellow Arizonans. This virus doesn't care what month it is or what holidays are coming up. If we want continued lowered numbers 2 to 4 weeks from now, our actions today make that difference. In a COVID fall, we're getting used to football games with no or few fans. Universities are models for testing, mitigation, and behavior change backed by enforcement. Trick-or-treating is scarier than we'd like, and vaccines could be the subject of Vegas odds makers. Maybe. One thing we know about life with COVID is that you can't be too surprised by new aspects of life with COVID. So let's get to it. It's time to talk about what we've been through, what we've learned, and what life with COVID-19 looks like as of September 29, 2020. Today, we have yet another COVID-19 roundtable, one where we're going to take a little bit of a look back before we take a look forward. Joining us today from the Arizona Public Health Association, Mr. Will Humble. Will, how are you?
Howdy. And I love this time of year because the weather's about to break.
It's a whole new season of hope.
Yeah.
That's right. Also joining us today from the emergency room, Dr. Nicholas Vasquez. Nick, how are you?
Doing great, although I'm not actually in the emergency room today.
Fair enough. And from Arizona State University, Dr. Joshua LeBaer. Josh, how are you doing?
I am doing great. I am also excited about the cooler weather and doing some more hiking again.
Right on. All right, Josh, if you were just to reflect back over the last 6 to 8 months of craziness for a second, what would be your key takeaways?
A few key takeaways. So first of all, we were among the later states to get it. We did not get it the way the East Coast got hit right away. In fact, although we were actually one of the first states to report a case, we had that one case at ASU that came from China and was self-reported, but then most of what we got in the state came from the East Coast and probably via Europe. We didn't really take off seriously until the summer. One possible interesting thing to consider there is that in the case of Arizona, our summer is our winter, right? That's when everybody's indoors. And so a lot of spread may be occurring here because people are hiding out indoors. It'll be interesting to see what happens as we head into better weather in Arizona and people can spend more time outdoors. The other thing I would comment on in terms of where we are in the last 6 months is that this virus has moved into the number 3 slot in terms of overall causes of death in the state. So it is behind only cancer and heart disease in terms of killers in Arizona. And that's sort of a sobering message, especially when you consider that both cancer and heart disease take years to take lives. And this thing has moved into the number 3 slot in 6 months. So it's a pretty deadly virus in the people who it affects.
Very sobering thoughts indeed. Nick, last 6 to 8 months, reflection, where have we been, where are we going?
Well, it's so hard to separate out everyone's personal experience from this broad public experience of the pandemic. Each story is an individual story of isolation or adaptation or despair that things are not the same as they were. I've been talking with parents, and distance learning has been a real challenge. The social isolation for elderly people has been a real challenge. The distrust in our fellow Arizonans to do the responsible thing has been a real challenge, getting reliable information. On the other hand, you can say there are some things that have been very positive. Once it became clear this wasn't just a thing and was actually real and a threat to people, I saw people change their behavior. I saw mask wearing, I saw social distancing while still trying to live their lives. So on one hand, we can regret or lament or despair the last 6 months of the pandemic. But at the same time, I've learned a lot about the responsibility that people feel towards each other and their willingness to do things if given solid information and a clear urgency to act. I know our emotional tolerance is 2 months ago. We want the pandemic done. But it's a reasonable expectation to say we are going to have to wait another 18 months before we're back to whatever we considered normal before. And that's kind of the sobering thought that I've got right now.
Some people think it'll never get back to normal again. On the other hand, Will Humble's shaking his head the other way and going, I don't know if it's that long. Will, Josh took it globally. Nick took it personally. Your reflections in the last 6 to 8 months?
I think we learned how sensitive this virus is to policy decisions that get made. Our states made actually some pretty good decisions in March and April, buying some time with the stay-at-home order to get things organized. But we also saw that when you come out of a stay-at-home order the way we did in May, without any compliance or enforcement with mitigation measures, that the virus amplifies very quickly. And if you don't adjust to it fast with policy interventions, it can spin out of control really fast. And that's what happened in June and in July. We also saw that when public officials get a wake-up call and realize that things have spun out of control, because in our case, the hospital system was overwhelmed, that different kinds of policy decisions can work also. Allowing the cities and counties to put in a face covering ordinance worked. Shutting the bars down right before the 4th of July holiday in nightclubs for a few weeks worked. It brought us back from the brink. Now we're in this pattern where those businesses are back open. The state health department and the liquor board and others have some compliance and enforcement measures in place to try to keep those businesses doing the right thing. We've learned that those indoor environments like bars and nightclubs and crowded restaurants are really dangerous for spreading this virus if you don't do things properly. So we've learned a lot about this virus. And so there's people I respect that I've heard them say over and over, we're at the mercy of the virus. I don't agree with that. We're at the mercy of the policy decisions that our elected officials make, and whether those policy decisions are informed by evidence or ideology.
And whether those policy decisions are followed.
Right. And that's the measure of an effective policy decision. And so take, for example, right now, the way we have it with bars and nightclubs. Originally, it was like bars and nightclubs can open again, but there was no compliance or enforcement system in place. And some of us did a whole bunch of advocacy saying, look, you've got to have control measures that are enforceable, or we will get the same behavior from the bars and nightclubs and their customers. And so they made some changes. And so how do you get compliance? Number one, you got to build trust, but you also have to have something that's valuable at risk. And those liquor licenses are valuable. The privilege of operating is super important for those businesses. So there you have it. Our universities opened, and I think the universities have done a good job, by and large, having a solid student code of conduct that's enforceable. They've got isolation and quarantine. They've got robust testing. The universities, I think, are a model, quite honestly. It's not perfect. And of course, there's going to be spread. But you think about the kinds of processes that they put together, I think it's really been a model. And in part, it's because they have advantages that we don't have out here in the regular world, because by enrolling in the university, you have a privilege that you need to uphold. You sign a code of conduct. And so they've got the ability to manage things in a way that we can't out here in the real world.
One of the things that we've done at ASU is we've instituted this sort of random testing where people get emails randomly to tell them that they have to get tested in the next 2 days. And I personally think that more than diagnostics, that's an intervention. When people know that they could get picked at any moment to go in for a test, and they really would prefer not to have to be isolated for 2 weeks, it kind of makes them think twice about how they're behaving and what they're doing. And so while we saw this initial burst of cases when the university first came back, the numbers have been dropping steadily. And now they are in pretty good shape, I think. I mean, they're not perfect by any means, but they are good. And I think that's because people know, A, they should be wearing masks. That, without a doubt, is the best thing we do. But I think the next best thing is this sort of random testing and knowing that they could turn positive if they're not careful.
Nick, what have we or should have we learned through the past 6 to 8 months about the nexus between healthcare and public health?
That's kind of a personal frustration. We have assumed erroneously that healthcare is an individual thing, individual behaviors, individual risks, individual actions, individual responsibility. In this particular case, the pandemic has demonstrated that my health matters, but so does yours, because my health somewhat depends upon yours. I would like to say that that point has been hammered home loud and clear, that everybody has heard it, but I don't think so. I think it depends upon the experience that you've had. If you've been someone who's had COVID or been exposed to COVID or lost someone to COVID or has someone who got very sick and is still sick from it, you're quite mindful of the impact that your behaviors have on someone else and on the world around you, and vice versa. But if you've so far managed to avoid it, like apparently 90% of the nation's population, then it just seems perhaps like an inconvenience for little or nothing. I still hope that we can come out of this understanding that someone's health is meaningful to me because I depend upon them to be healthy and also depend upon them to not pass along this virus. I'm not sure we've made that point super clear, but I think it's clear to me now that public health has been just ignored for a decade or more. And our inability to do kind of broad policy interventions, our inability to get ahead of this, and our inability to do the effective interventions that we all talked about are a direct consequence. We only have the control that we have because people got afraid and decided, fine, I'll wear a mask. But what didn't happen is public health wasn't put in charge, wasn't put in a position of authority, and wasn't put in a position to kind of dictate to even school board what they can or cannot do. It was left to the school board members to decide, the parents to decide. I feel that that's still a failure.
Will, as someone who's been in public health for a long time, did you see some incredible irony in the fact that it was public health that had to come to the rescue to keep the healthcare system from being overwhelmed, when in fact it's public health that hasn't had the investments and healthcare has?
Yes and no, but I think it's a cop-out to blame the failures in Arizona on the lack of funding for public health. Because I think what happened was the fact that the policy decisions weren't informed by evidence-based public health. That's why we got so out of control in June and July. It's a cop-out to blame everything on funding when we know how responsive this virus is to policy decisions. And when those policy decisions aren't informed by evidence, you can have catastrophic results. And that's what happened here. My attitude is that we live in a republic, or we live in a democracy, and that those elected officials are responsible for making decisions on our behalf, collectively, the small o. Those decisions in the case of a pandemic should be informed by seasoned public health officials that focus on evidence. And when there's a breakdown, and that might be because the wrong person's in the wrong job at the wrong time, or it could be because the elected official doesn't have an appreciation for evidence because of their lived experiences, then you have a disconnect in which lives can be lost. Under normal circumstances outside of a public health emergency, you can get away with that, and it's okay. But when you're in the middle of a public health emergency and you don't have evidence informing policy decisions, there's catastrophic results. I think that's what we saw.
Josh, speaking of evidence, ASU Biodesign was the place that built the definitive model for what ended up happening in Arizona. How do you feel like ASU was engaged or not engaged in being part of the solution?
Well, I think it's evolved. Initially, they were invited. I think there was some consternation over what the data were showing. And I would agree with Will that not everyone was paying a lot of attention to those results, but the results have held up. And I think now they are more engaged and participating more. Glad to see that people are embracing the models that they've generated.
Yeah, it's been fantastic work, really.
Yeah, got a great group of scientists who are doing that and working very hard to keep that information up.
So you're in a university setting, Josh, so I'll just ask you this question. 6 months is basically 2 semesters. What did we learn? If we were taking a final exam right now, what did we learn?
I think all of us are learning as we go. I mean, this virus was unknown to mankind a year ago, right? And this is a totally new virus. And if you think about all the questions that we all still have about the flu virus, which we've known about for more than a century, and then imagine how little we know about this virus, we're all learning as we go. We now know that probably the best mitigation factor we have is mask wearing. I don't think that was clear when this first started. In fact, even well-respected people were not sure that that was so important. They were talking about fomites and washing your hands, the importance of that. I think we now know that this virus doesn't only travel in large droplets. We know it travels in small droplets as well. And so while 6-foot spacing is great, it's not as good as mask wearing. I think we now have a much better appreciation for the importance of testing. I had conversations with important officials who at the time weren't clear on why we needed to test. They thought, well, it's just confirming what we already know, these people are sick. And I certainly had conversations where people were certainly not clear on the importance of testing asymptomatic individuals. And I am a firm believer in the value of testing asymptomatic individuals, especially as we now know in this young age group, right? The 18 to 24-year-olds who are probably, if you did it mathematically, comprise a reservoir, if you will, of virus because of their asymptomatic nature. It's like a zoonotic reservoir. And so I think we've learned that in the last little bit. What we still don't fully understand is the biology. We initially thought of this as an entirely respiratory virus. I think we now know that its effects on the heart are profound, and its effects on cytokines and the immune response are also going to be important. It's a lot to be learned about that. And what we certainly don't know are the long-term effects of this virus on people, even those who didn't have a profound hospitalization, but may still yet have lingering effects from the virus.
The bigger problem that we have is this complete lack of public health literacy. Over the years, we've sort of gone away from the idea that the expert knows better, and probably for some very good reasons. We talk all the time about health inequities, about how experts can harm when their biases are applied, that maybe they don't have the same lived experience. There's all sorts of reasons why health experts aren't the experts in everything. Whatever it is, I feel like we've seen that overall health literacy was low enough that folks were willing to believe any and all information coming out equally without reservation. And we sort of lost the ability to contain the information or get reliable, actionable information until the public found its way to fearful response. I don't think that was a kudos for us. I just think it's people were motivated to survive. And you've seen all sorts of folks try all sorts of different things, different types of masks, different mask wearing, mask over the nose, mask under the nose, mask on the chin. I do this, I do that. Everybody's got their own ritual. But as far as actual adherence to scientific literature or adherence to best practices, I don't know that we're winning that.
How much of that do you think is a result of social networks and the echo chamber effect? I've recently become more appreciative of the fact that different people are getting different information. The information is being tailored to them by their own online behavior, if you will. And not everyone is listening to the same sources of information. So some people may be hearing that mask wearing is more optional or it may not be as important. In the old days, we all had common sources of information, but that's not true anymore. Even when you do a Google search, your Google search may be different from my Google search. Take that to the next level in terms of Facebook and all these other social networks. Maybe people are hearing different things.
I don't think that's a maybe. I think that's an absolute. There's this great idea of the scarcity that a business can address is where the business model comes from. And when technology changes, the scarcity point changes again. So for us right now with the internet, there's no scarcity for information. You have tons of information. No one has a problem that they need to go to an expert for anymore. You can do a Google search. You can ask a friend. You can go on Facebook. But all these ways in which people used to get information are now highly leveraged so that you can get a ton of information and you may not believe it's any relevant at all. So our scarcity, our choke point right now is relevancy. What is this information? Is it relevant to me? Most people are not going to go to their doctor and go, hey, doctor, I saw this on Facebook. Please help me parse this out. They're going to go to their friends and the other people that they trust. So right now we have zero entry for the expert physician class into daily people's lives unless they're watching them on YouTube. No one is saying, you know what, I want to suspend my life. I want to call, wait 2 weeks, get in, spend 15 minutes with a busy doc who's looking down at a piece of paper so I can ask them a little question about whether or not lemonade is good for my gallstones. I think people are turning to the information source that's most convenient to them, and they're getting exactly what you think they're getting, which is a wide smorgasbord of low quality information that just simply confirms the bias that they already had.
Right.
Our business model in healthcare is still fixed to the idea that I'm a train station, so you're going to make an appointment with me, get a ticket, come see me. When everybody else is running around in 2020, when everything is electronic and sent by text and available, I still fax, for Christ's sake. Literally the other day, I had a patient who came in and had an issue and had been in San Diego, and I had to submit a request for a fax and wait days to get the critical information that we needed to better attend to this guy's issue. That's the state of affairs in healthcare. The world has moved on around us. It's 2020 out there and everything is available. So much so, I had some guy tell me, I'll email you my dad's medical history. I have a file. And I'm like, to what? My personal email? We are behind, and so behind that we had no way whatsoever other than I'm going to start a Facebook channel, a blog post, or a YouTube channel so I can get ahead of the misinformation because it's out there and readily available. This is like telling your kid, be moral, don't do what the other kids do, but not giving them any way to come talk to you when they've got a dilemma.
Will, it does seem like the amount of communication confusion was incredibly high when COVID started. Now, you've been through more than one pandemic. Was it higher than it has been in the past? And if so, was that a contributing factor to some of the choices and steps that were taken?
We're talking about two different things here. One is that sort of the democratization of information. That's social media, YouTube, all that kind of stuff. But I want to give a shout out to the Arizona Press Corps, those folks in radio, TV, print. They did a good job following the facts. They didn't get it perfect, but they did a pretty good job. So if you look at the Arizona Republic, the Arizona Daily Star, if you look at what the television stations were putting out, if you look at what radio was putting out, those are places that have editors and fact checkers, and they did good. But it's that world of where there are no editors, where all the bad information is.
The fact that you point out the press and editors and trusted sources, which I agree with, means we're the ones out of touch. We're the ones living in the past. We're the ones who say, this world doesn't make sense to me. I don't get it. Where are the editors? Where are the trusted sources? I'm going to go for an expert. And the people who aren't waiting for us. And even worse, there are intentional efforts, both domestic and foreign, to foment misinformation, disinformation, and to put people in opposing camps of us versus them through Instagram, through Facebook, through YouTube. That is daily. There are literally professional people who work every day to go do this. And all I'm going to say is that while we're waiting for the press to get the story right, which I think is just as important as you do, nobody else is. And we've lost that first part. There's no getting it back. Once somebody doesn't trust you or thinks, you know what, this person over here has better information that seems to apply, we've lost the ability to speak to the public and lost the ability to improve that public health literacy. The battlefield is more important than you think it is.
Okay, but I would say that in terms of what's happened in the last few months, to some extent, I think having gone through the crucible of huge numbers and huge death rates and hospitals overwhelmed, the optimist in me is hoping that Arizonans have seen that something has to be done, and they are starting to believe a little bit more that mask wearing and that mitigation factors and all that stuff does help. We went through Labor Day here, and we could have seen another Memorial Day, but we didn't. We saw a little bit of a bump, but it largely settled back down, or at least plateaued. I'm hopeful that people are starting to get the message a little bit.
Josh, you started the ball rolling on where we're going. You said we got a little bit of a bump after Labor Day, but that seems to have settled down. That even may have been attributable to testing and reporting. This is not a prediction show, but where do we think we might be going? Quite frankly, the virus doesn't know what month it is. The virus doesn't know that the holidays are coming up. Where do we think we might be going as we move forward, when in fact we think the only two levers we have, policy, behavior, and then we've got to deal with whether or not people change that behavior and whether or not they decide that they're over it.
There's this mixture of some people who, on their own personal level, are going to either maintain or alter their behavior. And then there's the policy effects that will take care of the folks that aren't going to decide on their own to walk away if they see a lot of people not wearing masks in a particular business. Even with the opening up of some of these counties, we haven't seen a big rise yet, so I'm encouraged. When I go out personally, I still see a fair amount of mask wearing, although that could be just where I happen to be. I think Nick's point about some of the more rural counties is a concern. I am hopeful that as the weather gets better, people will be able to spend more time outdoors where I think it is a little bit safer. It's hard to say. My guess, if I had to predict, is that we're going to kind of stay at this sort of plateau of roughly hundreds of new cases every day as opposed to thousands, which is way better, although I'd love to see it drop even further. I'm just hoping that we can encourage and get people to get tested more and continue wearing masks. I think those two things together would have a good effect.
Will, depending on who you read, Arizona's positivity rate as a state may or may not be below 5%. It also varies by county. Some counties are still in double digits. A public health official recently said, you guys in the Southwest should think of this like a forest fire. If there are still embers, if there are still flames, at any moment it could get out of control again. Is that a reasonable way to think about our immediate future before a vaccine?
I look at it like a car dashboard. Positivity is one of your indicators. So you have a tachometer, a speedometer, oil pressure gauge, temperature gauge. So there's all these things. And so that's what we have with COVID. We've got positivity. We've got cases per 100,000. We've got a 7-day moving average for new cases. We have hospitalization rates. We have deaths, which largely has to do with assisted living, skilled nursing, and exposures of seniors. To me, it's about looking at all of your entire dashboard and making policy decisions in time to make adjustments before things go bad. Our future hinges on those people that have been elected into positions that can make those kinds of policy decisions and the people that advise them in appointed spots, their ability to convince elected officials to do things in time and not wait for things to get out of control like what happened in June and in July. I'm totally convinced that this virus is very responsive to good and bad policy decisions. Did our elected officials and the people that advise them learn lessons? We'll see.
Nick, same question to you. Here we are. We're sort of in this waiting game for a vaccine. What do you think the next 6 to 12 months might look like? Again, not a prediction, but a sense of what we've learned so far and where we think we might be headed.
On one hand, I would say it's going to look similar to what we've seen before. You're going to have some groups far more susceptible to coronavirus who will not have the same loud bullhorn that other groups do. This disparate experience between one group of people who are predominantly getting the coronavirus cases, or several groups of people, as Wilhelm pointed out, the nursing homes and the people who work there, and then the impact that the pandemic has on the rest of us. So I think we're going to talk about the impact that the pandemic has had on the rest of us, but the people who are going to get it and get sick are still going to be the most vulnerable. And I think those are going to be the hardest to reach and the hardest to change. They have risk factors that are hard to mitigate by policy other than a mask. They have to go to work. They have to live there. They're vulnerable. They have comorbidities. It's really hard for us to kind of control their risk and minimize the amount of spread that they have. One part, you're going to have this biphasic experience. Most people aren't going to get COVID, and most people who do get COVID are going to get better. Some people are going to die. Some people are going to be forever impacted, and it's going to be a minority, and it's going to be majority minority as we go forward if we're not careful. I think we live with this for a while. I don't think that there's a big klaxon that says "Ale ale oxen free." It's all over. I think you get a vaccine and then it's a stage to the next part of the pandemic, which is how do we get everybody vaccinated, which is then a stage to the next part, which is how effective is it now that the virus has changed and morphed again. We're going to bump through this in our democratic way for 18 to 24 months longer. And if we sort of allow our decision making to be kicked down to the lowest level and we don't use the best evidence and we don't use the loudest bullhorn, we're going to lose that battle. We won't be able to define what the best practices are other than to try to get people to respond to the fear of losing their lives. I feel like this is where we've been, where we're going to be, and where we're going to continue to be unless something appreciably changes in the way in which we're responding to this virus.
Will, we haven't been in this room for 4 weeks. What's one thing from the past 4 weeks about any aspect of COVID that you want people to be clear on?
Please follow the golden rule. Be respectful of others. Wear a face covering when you're indoors and in public. Respect distances. Even if you feel like wearing a face covering violates your civil liberties, think about other people. It's the number one return on investment tool that we will have until the vaccine gets here. And if we all treat each other respectfully and recognize that wearing a face covering in public is more than just slowing the spread of the virus, that it's also a sign of respect, we'd be in a lot better shape.
One of the ways it's been expressed on the internet is grace in space. Grace in space. Josh, same question to you. Over the past 4 weeks.
For me, of course, the past 4 weeks has been colored by our experience at the universities. The thing that I have learned, particularly in this young age group, looking at the viral counts that we've observed, which in some cases has been staggeringly high in people who have zero symptoms. So I have really become even more appreciative of the impact this thing has in asymptomatic individuals. There is a population of folks out there who can be literally dripping with virus and not even know it. And I think that is a lesson we have to take home. That's going to continue. Quite frankly, I think the population at the university is probably now below that same percentage in the people who are not at the university, largely because they're being monitored constantly. I think we have to be aware of the fact that this virus is around. This burning ember issue that I've used before and that you alluded to earlier, I think is true. I think that it is always out there, certainly in this younger age population where they are largely asymptomatic. And we are going to have to factor that into how we think about the prevalence of this thing and how it could come back at us if we don't constantly pay attention to it.
Nick, same question to you. In the past 4 weeks, something we've learned about any aspect of COVID that you want people to be clear on?
The vaccination efforts are amazing. The politics of it aside, the fact that we are sitting here in September when this virus came on to existence in October, became known to the world somewhere in November, December, the fact that we are honestly 3 to 6 months away from having a vaccine is just astounding to me. I had the same sense of just awe when SARS first came out and we had its genetic code figured out in a few weeks. I'm a graduate of the molecular and cellular biology degree from some 30 years ago. I'm impressed with the scientific power that we have to do these things. Last 4 weeks, I've just really come to understand how far along we are in the vaccine effort.
Let's talk about vaccines. Will, where are we? What's going on?
I'm really super optimistic. We have several candidates that are in phase 3 trial. Moderna, AstraZeneca, Pfizer. There are others, Sinovac in China. The government responses, both in the Western democracies and here in the U.S., towards removing the financial and administrative barriers to making vaccines happen more quickly has been impressive. As Nick mentioned, the level of talent that's working on these vaccines to get us into phase 3 trials already, I'm really optimistic. And one of the big questions has to do with whether it's worth it to release vaccine under emergency use authorization rather than going through to full FDA approval. Full FDA approval is going to probably take 6 to 8 weeks longer than using emergency use authorization, because EUA, emergency use authorization, allows you to vaccinate based on the fact that it probably is effective and that the benefits are probably more than the risks. But if you go to full approval, I think you minimize the chances that we're going to deploy a vaccine that has adverse events that people lose confidence in. Me personally, I think it's better to go to full approval, vet it completely, analyze that phase 3 data using the independent folks within the ACIP. That's the committee that reviews this within FDA. Commissioner ends up making the final decision in the end. I think it's so important to have confidence in these vaccines so that we can put this pandemic behind us. If the initial vaccine ends up going through emergency use authorization and has adverse events that we could have known about but didn't know about because we took shortcuts, then we're going to undermine the public's confidence in all the other vaccines, and we won't get enough people to accept the vaccine in the end. It's super important, I think, to go to full approval and really go into depth on all that phase 3 data before we deploy the vaccine.
Nick, earlier in this show, you talked about people's confidence in the medical profession and in vaccines. The pharmaceutical companies themselves have co-signed a letter saying we want to make sure we go all the way through phase 3. You agree with that?
Absolutely. A lot of these vaccines are engendered to create an immune response. And to put it succinctly, immunity is where common sense goes to die. It's not clear how immunity is going to play out. Each one of us has the same tools, but each one of us has an immune system that is literally unique to us. And it can be different from the person that you're sharing the same household with. It is so weird, it is so strange, and it's so odd how immune responses happen. That's just a level of chaos and unpredictability to a vaccination that you need to take seriously. You need to go slow and make sure that there's not some population of 0.35% of people who then get Guillain-Barré and can never walk again. You have to go slowly because humans are deterministic. They make determinations based upon the consequences, not the probabilities ahead of time. So if the vaccine comes out and somebody gets harmed, the deterministic human will go, the vaccine is bad. And it will take us 20, 30 years of retrospective to figure out what went wrong for us to realize, well, sometimes stuff happens. People are just different. I think you have to be very careful, given the level of public scrutiny, the level of sort of dependency on this vaccine to solve our problems. You've got to take double, triple, quadruple checks. Otherwise, we just never get this opportunity back, and an entire generation of people will never trust vaccines again.
Josh, there's a couple of places where common sense can go to die besides immunity. I know there's a rumor flying around ASU right now that students believe that the version of COVID that is on the ASU campus is just going to take your sense of smell and your sense of taste and maybe give you a headache, so it's not a big deal. So how do you balance all this?
There are two concerns here. So one, of course, is the potential of adverse events related to the vaccine, but the other is this sense of security that you may think you have. So you think, I've had the vaccine, therefore I can't get it. And we don't know yet how protective this is or for how long these vaccines will be protective. And they may be wonderful. They may be like a good doctor vaccine, let's say, that lasts for years, but they may also be like a flu vaccine, which is maybe good for a year, or they may be good for months. We just don't know yet. We certainly don't know if you have the virus, whether or not you're protected, because there are plenty of viruses that you can get, and yet you still don't become resistant. There are all kinds of cold viruses, for example, that you get the cold, and then 6 months later, you can get a cold again. We just don't know yet how long these vaccines will be effective. And the worry would be, as soon as people get vaccinated, the masks come off, all the other mitigation factors go away, and maybe that's good for a month or two, but who knows how long that's going to be good for. So I think Nick hit the nail on the head. I mean, the history of vaccines and how effective they've been is quite varied. There are some things that we've been trying to get vaccines for a decade or more and still have yet to succeed at getting a successful vaccine to them. And then there are other things that just seem to be more amenable to them. So we just won't know, and we really have to be careful.
Last question to all three of you. I'm anointing all three of you as odds makers in Vegas for the timing of a vaccine release.
Release, April 2021.
Odds?
70-30.
Will?
70% by January 1st.
Josh?
They've already released one in China, right? So they're already vaccinating people there. I think I would probably split the difference between the two previous predictions. I mean, I think it is going to be first quarter of 2021. I'll go with 80-20 by February. What the heck?
Thank you, Will. Thank you, Nick. And thank you, Josh. We are lucky to have your insights. But please, stick to your day jobs and do not become Vegas bookies. The whole odds thing works a little differently, guys. We're just going to leave it at that. There's one subject about this fall that we didn't talk about with our guests, so let's be clear about it now. A twindemic of flu and rising COVID cases is possible, and avoiding that twindemic is up to us. So stay COVID smart. Get your flu shot now to help avoid the combined effect of the flu and COVID on your neighbors, healthcare professionals, and hospitals. Next, make sure you continue to wash up, mask up, physically distance whenever you can, and keep a heads up for each other out there. Like Josh said, we get to go outside more as the weather cools down, and for COVID, that's a good thing in terms of open air and physical distancing. Double points for masking up, by the way. It can help prevent COVID and the flu from spreading. Remember, we're in a marathon, not a sprint. By being in this together, we'll get out of this together. One last thing about this fall season. Just after our mini-sode last week, stating a September 30th deadline, the courts have spoken and the U.S. Census deadline is now October 31st. Do your part to make sure everyone living in Arizona gets counted. Encourage people to visit 2020census.gov today. That's 2020census.gov. Our COVID-19 Roundtable will be back in 2 weeks, but the podcast itself will be back next week with yet another conversation on health and well-being in Arizona. In the meantime, don't hesitate to delve into our back catalog of episodes. We've got nearly 50 episodes to choose from, which means that there is a lot to listen to, including guests from across the state and national experts too. Visit us on the web at vitalisthealth.org/podcast. Check out all of our current and past episodes on Spotify, or simply reach into that podcast app you're using right now and select another show to find out what's going on related to health and well-being in Arizona. That's it for this episode. The takeaways from this dialogue belong at the family dinner table as much as they do in your place of business, in city and town halls, and in the domains of healthcare and public health. So please, share this independent episode far and wide. Subscribe to the Vitalist Spark podcast to get notified as soon as new episodes are released, or listen to the Vitalist Spark just like you listen to your favorite music on Spotify. Give us your feedback wherever you get your podcasts, or you can give us your input the old-fashioned way. Your corrections, complaints, and compliments are all welcomed by emailing us at feedback@vitalisthealth.org. Finally, remember this. With great responsibility comes great power. We'll see you back on the road to well-being soon.